the CARES Act. I know you guys have been, writing in your questions on that, and I appreciate that. I'm going to try and get to all of your questions a little bit later in the show. We're also going to cover some ideas for community outreach and things that you can be doing right now within your clinic to reach out to your community. And then we'll give you just some brief updates on telehealth. I don't want to beat a dead horse. I know we've been talking about that quite a bit lately, but we have had some updates on that topic as well. So please keep the questions coming in. We'll continue to answer them as we get them. But I did want to introduce you to our panelists. So we have Ali Ferrara on the conversation today, who will be giving us those updates on telehealth. We have Mike Gorman, who will also be contributing to telehealth. He's one of the senior coaches here at MEG. And I forgot to say, Ali is our billing manager. Plus we have Brian, of course, the founder of MEG Business Management, Matthew, our media director. And then we have a very special guest today, Bettina Barden Sorensen. And she is going to, we're going to start with talking to Bettina as well. So the reason why we're bringing Bettina onto the show is, again, I've been mentioning how we've been fielding a lot of questions, through email and phone calls. And just in an email exchange with Bettina last week, she had asked a couple of questions, and then the final email that she gave to me, she mentioned some of the things that she's doing for people in her community. And it really kind of struck a chord with me and kind of inspired me a little bit, because, here we are in the midst of this pandemic, and, you have this tendency to want to go into that self-preservation mode. And here is somebody who's going through it as well, but yet she's thinking about others in her community. And I thought that was just really touching. And so many of you are, and I know we have the most wonderful clients that we work with. And I've actually had the privilege of working directly with Bettina as her coach. So I know she's a person of extremely high integrity. But I just wanted to introduce you to Bettina. So Bettina, if you can just share a little bit about yourself and your clinic so everybody can kind of get to know you.
Okay. Well, hello, everyone. And I hope you guys are all doing well and staying healthy through all of this. Sorry, I'm looking at my front office is just now sending me a text about they're in the front office with an issue, of course. Anyway, okay,
there's not a single person listening.
I'm going to tell you, Bettina, this is the type of person Bettina is. She is literally so always concerned so much about her people. And I mentioned a little bit about personal integrity, and we talk a lot about that in our training in MEG Academy. And when we talk about this, we have to think about ethics first. And ethics is that internal barometer of right and wrong, whereas personal integrity is you acting on it. And I say that because I think that's such an important component of being such a strong leader. And here she is right now, going through it. She is worried about her people, which is awesome. And she said, I'm a little hesitant to do this, but if you think it's going to help people, I really want to be a part of it. So, I so appreciate you taking the time and stepping in and doing this. And I know everybody is so busy right now. So first off, I just want to thank you for doing that.
Oh, you're so welcome. It truly is it's an honor to be able to do this. I'm excited. Okay, I think everything's okay in the front office. I just texted them. We're good.
Good.
Yeah, so my name is Bettina Barden Sorensen. I'm a physical therapist. I have been a physical therapist since 1997, and I opened, or 95 actually, sorry. And I started my clinic in 1997. And we are located in Hood River, Oregon, just about 60 miles east of Portland, Oregon.
Perfect.
So, yeah.
And tell us a little bit about how things are going in kind of your neck of the woods. I know everybody's kind of been affected a little bit differently. What have you had to done, and what have you had to do, and where are you at right now in terms of how much things have affected you with coronavirus?
Right. Well, luckily in our community, things are going pretty well. We have 2 confirmed cases, but there seems to be a lot of people that are still going to the hospitals. I know the ER has been crazy busy here, and the primary care docs have been very busy, and clinics. So, I mean, I think we're we're feeling fairly safe, I think, right now as far as the numbers. But Portland, you know, we're pretty close to Portland, so that's also kind of close to home for us. I mean, for us right now in the clinic, we're, you know, I had to lay off some of my staff, and the physical therapists and admin are still working, less hours, but still working, and we're doing a lot of telehealth and the e-visits. But I feel like we were pretty prepared. You know, we kind of started mid-February, kind of thinking worst case scenario, and came up with a game plan and started doing a lot of information gathering and research, and how could we, you know, be better prepared when and if it did get bad and we had to like shut down or really limit our access to patients. So I think we were pretty prepared, and I think everybody's pretty calm right now. I mean, I think everybody has that natural fear just because of this crazy virus and seeing how horrible it is for so many people in the world. But we're staying pretty calm, and we are staying somewhat busy, you know, not as busy obviously as we were, but I think we're managing pretty well.
Good. Well, and I know, you know, you really have that kind of calm demeanor, which I think is so important as a leader. One of the things that, you know, I wanted to talk about a little bit, if you're comfortable talking about it, is your journey that you've been on within this past year, because you've had to overcome some challenges in the last year. Can you share a little bit about that and how you've kept perspective?
Yeah. Well, I guess in September, it was, beginning of September, I was diagnosed with a second cancer. My first one was in 2010, and that was breast cancer. And this one was this September, and that one was uterine cancer. So so it was definitely scary and challenging, and but I'm doing well now. And you know, I don't know, I think it's like, if somebody, like when you were asking me, you know, how do you manage it, how do you stay calm, and I have to say it's just like dealing with this crisis and having the clinic. And I think I've just always been an optimist by nature, and when these kinds of things happen, I just always believe that there's going to be something that comes out of it that's good. And even with my cancers, I definitely have grown, and I learned a lot. And I wouldn't change anything, because I think I'm a better person actually after going through them. And so when I'm dealing with this new crisis and trying to help my staff stay calm, and my community and my friends and my family, it's kind of the same thing. I mean, I hate the pain and suffering that's going on, and that's the worst part by far. But I think just kind of handling those things, and you know, being grateful for the things that are around you, small and big. And I also had an amazing support. My family, our 4 sons, my husband, my friends, my family, extended family, and then my staff. They're awesome. I was able to take pretty much 4 months off of patient care, and they stepped up, and I never felt the stress of the clinic during that time.
Yeah, and I will tell you, I can confirm that, because I remember we had some coaching sessions scheduled, and you always were so selfless in how you're going through this, and would always give all the credit to your staff and how amazing they were and how wonderful they were. And I think it just speaks volumes about the person you are. So
thanks. Well, they really are. And even like dealing with this whole coronavirus, you know, trying to figure stuff out. I think that we've done a great job, and it's only because every single one of them had great input, great suggestions. We brainstormed it together. It was definitely not all me coming up with the ideas, and that's been kind of a good thing for all of us. It's actually brought us all, I think, even closer, because we've just really been able to work together to try and do better for the clinic and the community.
And speaking of that, I do want to hit on that topic, because, you know, when you wrote to me, I was like, oh, those are some really good ideas. Would you mind sharing some of the ideas that you had in giving back to your community that, you know, you're a part of?
Mm-hmm. I mean, the first one is that we pretty much, you know, we called a lot of our patients and just checked on them. And a lot of it was our elderly clientele. And just to chat with them and check and see how they're doing, if they needed groceries, if they needed anything, and to let them know that they could always call if they had a problem, even though they weren't coming in. You know, we kind of had told a lot of the patients that were high risk that we really felt like it was better if they didn't come in, but we were still here, and that we were going to be doing the e-visits and televisits if they wanted to go that route. But I think just calling people, not just patients, but even just community members, and that we knew that were isolated and needed some help. We also put it out to the emergency room at the hospital here and the primary houses that were seeing patients kind of on the front lines, that we would do free televisits for any of the healthcare providers that didn't have time to get out and get some help if they were having pain. Because we had a few of them, like I had some call me with just pain, you know, neck pain. I'm sure it was all related to stress, or lifting injuries, and they don't have time to take care of themselves. So we were taking phone calls at night and on the weekends. So that was nice for them. I think they appreciated that.
Yeah, that's a great idea.
Yeah.
That is a great idea. I don't think anybody's thought of that. I haven't heard of that yet.
Yeah.
Yeah. So that's been, because the other thing is they are around sick people, so they can't really go out and get have a physical therapy visit or, so we just talked, I just kind of made sure there weren't any red flags, and then we were able to give them exercises and modifications to some of the job duties that they had.
Right.
Stress management, kind of wellness type stuff.
Yeah. Because if you can't take care of them, they're not able to take care of others.
Yeah.
So I think that's awesome.
Yeah.
Very
so we
good.
did that. I'm actually picking up some aluminum stays for masks. There are a lot of people that are sewing masks in our community, and I don't sew, and that would take me forever if I had to sew. So I'm folding aluminum stays for the nose piece, and a few of our staff members are also going to do that. And then we just made a big sign. I think I sent you that picture, Nicole.
Yes.
And that we had a sign, the print, one of the businesses here in town, we had to make a big sign that just said thanks to the essential workers and healthcare providers for still taking care of our community.
I was trying to find it while you were talking.
Oh yeah.
Right here.
So we've had feedback from that. We've had, I've gone to the grocery store actually, and some of the people in the checkout were like, "Oh my gosh, thanks for the sign."
Oh, see, that makes such a big difference. And I applaud you for doing that. I think that's great. We'd love to hear from everybody, from all of you as to what you guys are doing, because again, I know we have such great clients, and I know everybody is kind of doing something to kind of give back to their community. So if you have ideas that you would be comfortable sharing, if you want to go to our Facebook page and add them there, or email in at info@macbusiness.com, we'd be happy to share them for you. I feel like we have such a good tight-knit community. I was telling Brian before we started this, it feels more like our clients are like family and friends versus actual like clients, because we just become so interconnected, and it's such a great community. So we learn from each other. So thank you for sharing that, Bettina. Brian, I'd love to hear from you now. How does this tie into, what you're doing now can actually help strengthen your company later?
Well, I think Bettina really is a shining example of what that's like. Even before this pandemic, during this pandemic, during her crisis, I met Bettina when she was in the midst of all that and just coming out of her staff, and she was wrestling with all those options. And it was just an amazing thing when, I want to ask everybody who's listening to just like ask yourself, when this is all over and you look back on it, what type of person do you see in yourself? Like, where did you see yourself when you look back? Did you see yourself as totally acting out of self-preservation? Or did you see yourself as saying, this is an opportunity for us to really do something for others, not just ourselves, for others. And I don't just mean the people in our community and walking down the street. I mean, our staff, all the allied health professionals that we've worked with all these years, all the referring physicians, Nicole's married to a physician, and he's not working. you know, who's reaching out to him? And Nicole's waiting for a wisecrack on that.
I'm waiting. It's coming.
She's waiting, but I am being serious. I don't want to drop a joke on it. I really
Yeah.
want to know, like, there's a lot of just real opportunities here for you to make the first footprints in the sand when you're walking across, to be the first one to make those prints. When everybody else, like when this thing hit and I would go to the grocery store and toilet paper's flying off the shelves, meat's going, people are buying eggs. I don't know why they're buying eggs. You can't freeze them. I don't know why everyone's buying these eggs, but they're doing all this stuff. And literally I was telling my wife, like, I had my little earpiece in and I'm talking on my phone. I said, you know, the vibe I'm getting is like, everyone's like, just get, oh my goodness.
Mia doesn't like it either. I'm telling you.
People are just like, get out of the way, you know, I got to get in. I have to get in there first. I have to hurry up. Right. And it's just like the wrong mentality. You know, I'm walking in like, please go first. Please help yourself. You know, does anyone need a wipe? I immediately went and bought alcohol and aloe and made sanitizer and emailed all the people that I knew, like, who couldn't buy it at the store. I said, hey, I just made a whole batch of sanitizer. Anybody need any bottles? Just bring me by an empty bottle. I'll fill it up for you. And they're like, oh, that's awesome. Right. So it's just like, it's not, you know, we do things too often for the reward of it, instead of the action of it being the reward. And I think that's what Bettina emulates. And I think that's what you connected with her well before this pandemic, because that's why you asked me, like, I need to bring her on this episode. And for everyone here listening, like, we really do want to see you chime in. Like, what are you doing? Like, I'm saying to people, this is an opportunity for you to change your brand to, I'm here to support my community. It's community first, people first. What opportunities do we have to help others? You know, what can we do? It's just that moment in time where you really have to ask yourself, and then let it carry on for the rest of your life. Strive to be, you know, I told Nicole today, I'm 52 years old. Strive to be a better 52-year-old than I was 51, better 53-year-old than I was 52. Okay, Mia, now you come in. Oh,
always stealing the show.
After all that barking, now she comes in like, I didn't do anything. So anyways, that's kind of the whole idea of this episode, is to really coordinate your persona, your beingness, about who you are. I mean, look, there's only two reasons why you get into physical therapy in the first place. I've said this on my podcast 1,000 times: to help as many people as you possibly can, and to provide the greatest amount of help and support with each and every engagement. If you really do believe that, and that's really why you became a therapist, and isn't that who you are in life? I mean, isn't that who you want to be when you walk down the street? This is an opportunity for you to really be that, and not be the hoarder, and not take all the eggs off the shelf, and not have 16 months of toilet paper sitting in your kid's bedroom, because God knows what's going to happen with the toilet paper industry, right? This is not the time for that. So to segue my segment into that, I just didn't want to take anything away from that, because I think it's so important. And I think that's why, Nicole, you feel, and I know I feel, we are devastated if we can't exceed the expectations of our billing clients, of our Meg Academy clients. And no one's perfect. Everyone will skin their knees, but how do you react? Do you blame the client? Do you blame others? No, we will dig deep. And you're going to hear that from Allie. And that's really, really important. So that's my thought on that. My job on this whole Nicole's telecast here is to provide the mechanics of how you can persevere with logistics, mechanics, and good administrative thought processes, and balancing and adding that kind of 2 cents. So what do you want me to talk about right now? Or do you want me to
No, you wait your turn. Wait your turn. We're good. It's Allie's turn next. Allie's going to jump in. She's coming unmuted. So we're going to give you the latest updates that we have on telehealth. And thank you again, Bettina. I really appreciate you sharing your story with us and some of your ideas that you have, which I think are fantastic.
Yeah,
so
absolutely.
As we
thank you for having me.
Of course. Okay, Allie, you're up. Let's hear the latest of what we got in terms of the telehealth world.
All right. So I am going to start with the good news first. So my billing team has had success billing telehealth claims to 2 carriers where we've actually had the claims process and pay. Those 2 carriers are Blue Cross Blue Shield of North Carolina and then Regents. And both those carriers are processing and paying the claims at the same rate as you would be reimbursed for an in-person visit, which is awesome too. We are still waiting to hear back from other carriers at this time, but we did have a lot of clinics that just started billing telehealth as of last week. And these claims take some time to process too. We would love to hear.
Allie, can I interrupt you just 1 second? I'm just curious. I was told that some of the advice we should give people listening to their billers and their bill is that when they call to verify benefits, they should ask is, should we bill telehealth? Will we have the coverage in parity? And if we should have the coverage in parity, will we have the reimbursement in parity? Is that terminology that you guys are coaching people on and using yourself when calling or when having all of our clients' offices call and verify benefits? Is that what they're asking? Do I have coverage in parity? Do I have reimbursement in parity? And could you explain to the audience what that actually means?
Yeah, so we're having them ask if they're being reimbursed in parity, and what that means is that you're going to be reimbursed the same amount as you would for an in-person visit. So no matter how you're billing, if you're billing with the 02 place of service code, you're going to be reimbursed the same way as if you were billing with the 11 place of service code.
Good, good. So that's important for everyone to hear. When you verify these visits and they're getting denied, have you documented that you've got coverage in parity and reimbursement in parity? Coverage in parity, explain that.
I believe that's the same, reimbursed in parity.
Well,
I don't know.
reimbursement parity, what I was told, it's great. Look, guys.
You're teaching me something.
There we go. This is what this is all about. This is what the forum's all about. So coverage and parity means they're going to follow the same coverage in terms of authorization visits.
Oh, yes. Okay.
Medical necessity, visit limitations. The coverage rules and regulations for that diagnosis and that treatment is the same versus reimbursement parity. We're going to pay you same per CPT code.
Yes. And then some of the insurances we're finding, I don't have any on my list right now, but some are stating that no patient balances are going to be due for telehealth visits at all. So that's an important question to ask too, to add to your list. A lot of the insurances some of them are starting to waive copays, co-insurance, and deductibles. And you'll see it and you'll think that it's just for diagnosis relating to COVID-19, but a lot of them are waiving them across the board no matter what.
To lessen the economic hardship on the public.
That's
Yes.
unheard of.
Wow, that's fantastic. Do you have a hotline to the Trump administration? Is that how you? That's awesome news right there. Boy, that's
everybody check your governor mandates. I mean, APTA has a great list of all the state mandates that are out there, and a lot of them, the governors are mandating that you be reimbursed in parity.
Nice. And that's from the APTA site. They can go to PPS site and get that.
Yeah, they can go get that. And then APTA also has a list of the insurances that are covering telehealth right now. I think the last time it was updated was probably 3 or 4 days ago. So it might not be as up to date as we are, but it does have some useful information on there as well.
Okay.
Yeah, and that's why we have our resource page. So we can keep giving you guys can keep going to
I
Allie
lost
has
him.
a hotline, and she has a hotline right to her Apple Watch. So if there's a bulletin or a change in the world's environment, it's going to ring her, and she's going to update that page. So there.
An update for Allie.
Uh-oh.
I got a quick update for Allie. Allie.
Oh, let's hear it.
As of April 2nd, which is today, Aetna covers telehealth and follows the same as United Healthcare. So Aetna and UHC should be paying for all telehealth, the evaluation codes, all the other codes, but not manual therapy, of course.
Awesome.
And you do need to put the GT modifier on there.
Does it say anything about a place of service code?
It did not.
Okay.
But that's excellent news. So Aetna and United Healthcare, yes on telehealth.
Yay.
And then we have a question from Mindy. She's saying, is it true that Blue Cross is only paying for in-network in California? And I'm sure you don't have the specifics on every single state, but is there any input or in direction you can provide for Mindy?
I do not have that information. All I have right now is that Blue Shield and Anthem are both covering telehealth. I don't know if it's just for in-network. We don't have anybody that typically bills out a network for California, but I can take a look too.
So yeah, that would be great. But I think they could find that out through verification, right? That's just a phone call.
Yeah, definitely. Yeah. And I would look on their website too and go to their COVID-19 resource page.
Good. Okay. She said it was what we were told. Okay.
Oh, well.
And then maybe give us the bad news, Allie.
Okay, so bad news is next, and I'm not sure if anybody else has taken advantage of the e-visits for Medicare, but everything that my billing team has built out has come back denied. We received probably like 37 denials in the beginning of this week. And when we call the Medicare Max, they are telling us that physical therapists are not eligible providers to bill for those e-visit codes. I did call another MAC yesterday and just call and follow up and verify. And I'm being told that they are waiting on guidance from CMS and that a lot of providers are experiencing this issue at this time. So it seems to me that it is just kind of a miscommunication, and CMS is going to send out an email update when everything is squared away. But the verbiage is there on the Medicare bulletin, and it specifically states physical therapists are going to be covered for this benefit. So I think it's just going to be a waiting game. If you have those denials, definitely call into your MACs and definitely try and get updates as much as possible. I think maybe if more providers call in, they'll get moving on it a little bit more.
Yeah, this is infuriating because we all know Medicare has it well written that e-visits are approved and acceptable for physical therapists to perform, and then the MACs take it upon themselves to find some, well, we haven't gotten clarity or whatever. This kind of thing is just, this is the problem with our system. I don't even want to get off on a soapbox on it. But the reality is, Allie, I think we all kind of agree that since Medicare has already, address this issue, once they clean it up with the MACs, wouldn't you assume they're going to backdate coverage? And number one, and number two, even if that doesn't happen, don't we owe it to our Medicare patients to do the e-visits that are necessary just for their best interest and their best health? I mean, this is what Bettina is all about, right? This is what we should all be about. Shouldn't we intervene and provide the care that our patients need so they don't regress and have further complications and deal with the finances of it on the after side? Look, financially, things are already off the rails. So care for your patients is our advice. Care for your patients to the greatest of your ability, and then work with, like for our people, they don't have to do anything. They just work with our billing team. Our billing team will go to battle and go for the fight, and we will do everything we can to get those things backdated and covered. Wouldn't you agree?
Yeah,
John,
absolutely.
yeah. I'm sorry.
Yeah,
Sorry, I meant
I
to
would-
jump in. Go
I
ahead,
would
Allie.
definitely not stop seeing the patients for e-visits at this time. I'm not sure the exact date on the Medicare bulletin, but it was effective early March that therapists could complete these e-visits.
Yeah.
I would definitely just hold the claims at this time until you get more information regarding how they're going to process.
Yep,
Yeah.
absolutely.
And it sounds like there's, denials all over the place. Dawn typed in the question box that Kansas MAC, they were told that the e-visits would be covered, but not telehealth. So I think it's just confirming it's a matter of time. So hopefully within the next couple of weeks, we'll see that ironed out. Is there any other questions on telehealth at this point? Otherwise, we'll say thank you, Allie, for that update. We appreciate it.
Is there anything else, Allie, that you want to share? Those tips, unlike, you deal with it every day and it's just common secondhand knowledge for you, but those tips for people to hear, like how to exactly ask the verification questions, what exactly, those are silver bullets for so many people.
Yeah, and I think that the Health in Motion magazine had some really great questions asked. That's what I've been sharing with all of our clients at this time to go ahead and make sure they're verifying and asking the correct questions. The really important question is also, you need to make sure they're covering physical therapy codes. I don't know how many clinics I have and they're calling and they're saying, is telehealth covered for PT? And then the insurances are saying yes, and then they're getting off the phone and telling us it's covered and we're billing the PT codes, and it's not, it ends up not being covered.
Okay, we have a question from Brandon, and it says, is there a resource, website or otherwise, to help us understand how to set up telehealth in our respective organizations? It would be helpful if we had a centralized resource to help us set this up step by step with their payers to support PT.
I'm
telehealth.
sorry, Nicole, to chime in. I know our go-to internally is Mike Gorman, and he's going to step in here. He is a resource and can definitely help you with that. Our outside resource currently is TelePT Solutions, Daniel Seidler's group. So you can go to www.teleptsolutions. Solutions. And we have been working with them, shoulder to shoulder on a weekly basis, sharing data, sharing information, and staying as current as possible. So there's some really, really good data there. Mike, maybe you have another resource that you would refer to?
Yeah, actually, before I do that, can I just give a couple other telehealth updates real quick, just so we can kind of wrap that part up, and then we'll talk about the other things. Back on March 31st, people were a little bit excited because CMS came out and they were including therapy codes in telehealth. But the article said they stopped short of allowing therapists to bill for the therapy codes. So I think we're a step closer to it, but again, I just want to make sure that everyone understands that we cannot bill telehealth for a Medicare patient, but we are getting closer. But that brings up an important point. We all have to lobby for everything we want in our life. We've got to fight for everything we want in our life. So now is the time for everyone to call your state legislator, to call your payers, to call CMS, to just be a strong lobbying voice right now, because we're right on the cusp of something pretty awesome. So,
yeah. And Mike, I want to say something. Mike, what you just said basically in summary is they have approved. This is the craziest thing. This is why I want to say it back to you. They have approved the services of physical therapy for telehealth, but not the providers.
correct. They approved our codes.
Just want to be clear. They've approved the services through our codes of physical therapists for telehealth, but we haven't included the list of people that actually use it, the physical therapists themselves. It's just so you're right. If we lobby and we push that, we could actually get on that list. Although Amanda was here on our conversation on Tuesday, and she gave us a whole write-up on how Verma was able to actually include us through a pretty long connect the dots assumption,
Right.
which I think is great. But I still would feel, and I think many of us would feel, we love to see our names etched in the roster as a preferred provider, as an approved provider.
And I have a good practice management question for you, Mike. I think this is a good PT kind of perspective question. We have somebody asking, how do you convince a patient for telehealth? They're rolling their eyes, and one patient even asked, is this the new way to make money out of us? So I think that's a interesting take on that question, but go ahead, Mike, I'll let you shoot.
So I'm in a pretty unique situation in the fact that the employer that I was working for, I no longer work for that employer. So I started my own telehealth company in about a week's time frame. So but I have talked to people that, talked to people that, I treated before in the past, and I knew I started this and they didn't quite understand how I was going to do that. You have to frame it as that we're providing care. No, maybe we're not providing direct hands-on manual therapy care, but we'll still be able to use our education and our knowledge to help them with the healing process. So it's really, we need to just turn around. No, it's not about us. It's about you. It's about us helping you. It's not about us making money, because the reality is we don't know when we're going to get paid on these claims, and because we all know we've been told things before and it didn't happen. So I think it's just framed, no, we're merely trying to help you in a time that we know you can't come in and see us.
Yeah, and I see it as like a break in reality. Their perspective is like, well, how can you possibly help me? And you have this like arsenal of knowledge that you can help them, and they're way better off with you guiding their care versus without you. So I think it's a matter of getting to that perspective, that similar perspective, so they can see things through the actual reality of how we're able to help them.
Yeah. But I think the main thing is you first need to make sure that in your state is telehealth allowed.
Mm-hmm.
You have to look at your practice act, and then you need to see what changes have been made. There's been all kinds of exceptions being made. So you first need to check your practice act, because whatever state you want to practice telehealth in, you need to be licensed in that state, or you have to be in the compact. So if your state is in a PT compact state, well, that's good, but you still have to apply to be in the compact, and then you have to make sure that state allows telehealth, and you need to be practicing. Do you need to be located in that state? So there's lots of steps you have to do. That's really first thing, though, is doing that. And then you need to find, there's many different options as far as a HIPAA compliant portal that you have to log into and the patient logs into, so you can meet in the middle in a HIPAA compliant area. There's many options out there.
Yeah.
I would just be cautioned, if anything is free, you truly get what you pay for. So be careful with that. And then you have to you've got to, it's a real patient visit. So you have to document. You have to document just like anything else. There's got to be a need for it. So, and you got to learn, I really encourage you all to get good at technology, because if you're on the screen and you're trying to talk with the patient and you're fumbling around, then that sort of maybe lowers your credibility just a bit. But if you can get on there and you're smooth and you're sharing screens and you're doing that, I think that's a big help. But
and Mike, I think another important thing is for people to realize when you do an e-visit, which is apparently approved by CMS for all of our Medicare patients, of course, the max that you heard from Allie about that. But when you do an e-visit, it doesn't coincide with the plan of care. It has nothing to do with the patient plan of care. It is an intervention to help the patient so that they don't have problems, confusions, conflicts, regression, things like that. That is the whole essence of an e-visit. Telehealth is in accordance with your plan of care. It's an extension of the patient care, and telehealth has been done for years and years by other medical professionals. So when if somebody were to suggest to me that we're now doing these services because it's a money grab, I would say, honestly, we're just catching up with the times. To be sincere with you, multiple medical professionals have already been approved for years and years, providing remote healthcare services, not only in this country, but in countries around the world. And honestly, it took a pandemic for our country to allow the red tape to be broken and allow us to have access to providing people the healthcare they deserve in the comforts of their own home. I think you have to actually think through what you're going to say, so you're coming across as an advocate for the patient. I always tell people when I train front desk staff, when I hear you talk to a patient, it better ring in my ears like you're a patient care advocate, not like you're trying to sell your service. Or that's why I don't like walking into a PT office and seeing pillows and bands and straps and braces and stuff. I'm like, what, are we a store? Are you the Walmart of physical therapy? Are we providing a service of physical therapy? Are we trying to be a chiropractor here and sell vitamins on our waiting room? Or are we trying to provide the services of physical therapy? It just calls into question where your allegiance lies when you have that. So that's just my personal opinion. I may get some hate mail on that, but I like to just be sincere and genuine with my patients when I see them. So I highly recommend be comfortable communicating that to your patients, that honestly, this is the furthest from the truth if you're thinking this is some sort of money grab.
Yeah, and just real quickly, we had a question come in about the e-visits, and to my knowledge, this hasn't changed, and correct me if I'm wrong, Allie, but it's a one week period. It's not consecutive,
That's right.
Week after week, correct?
Correct.
Okay. All right, so hopefully that clears up that question. Okay, I don't want to linger anymore on the telehealth topic. If there's additional questions, please keep coming, keep them coming, and we'll revisit again as needed as the updates continue. I do want to jump over here, Brian, to the CARES Act and just briefly revisit so we can get some explanation. Just so you guys know, we pre-recorded this particular section of this webinar, and it's not going to be the same. It's a different one Brian did, but it's going to be available on our website, and Matthew's going to put the link up, and it has a blog associated with it. So you can kind of see it scripted out. A lot of your questions and answers are on there. We've put them on there as well. But we're going to go through them live here once Brian gives a quick revisit of what this CARES Act is and what it means to you.
All right, so very good. Thanks, Nicole. And for all of you, I'll try to keep it very brief. Prior to the pandemic, we've always had the SBA as part of the governmental administration. It's Small Business Administration, right? The Small Business Administration has predominantly serviced our community in business and supporting us in business in startups, expansion, things of that nature. Also in times of disaster and economic hardship. So they've always had a certain lineup of programs. So in that lineup of programs, if you're a startup, and I'm just going to refer back to some of the questions from our last live Zoom session. In that live Zoom session, we had a ton of questions coming up. And so what we did is we screenshotted those, and that's the video that Nicole's referring to. I shot a 20-minute video handling all of these things. So I'm not going to replicate that here necessarily, but I'm going to hit some of the top ones, and Nicole has some questions here written down for me. But I want you to understand that you can go refer to that video and get a lot of good information, but I also want you to understand how SBA works. It is a arrangement between the federal government, and the banks, the FDI insured banks and credit unions, they have an arrangement with certain parameters for each one of their funding programs. You, under all circumstances, are dealing directly with the banks to get the funding for what you're looking for under normal non-pandemic times. So if I was going to be a startup clinic and I needed some startup capital funds, I'll go to SBA, 7A, I may get a 7A loan, I may get a 504, I may get a micro loan. Those are all their traditional capital financing packages for startups, or if I'm going to expand or I'm going to buy inventory, I'm going to open another office and whatnot. Then you have certain packages, certain opportunities within SBA in hard times, right? Some of them I have up here that are very common, like the EIDL, right? The Economic Injury Disaster Loan, right? So that loan is a program. I have folders on all of them here. So you should apply for that in a time of a disaster, right? This is a disaster. So many people have gone on and they've applied for that. And it's a very simple application. It would look like this. It's a very simple application like that. You do it online and you provide your financial data. That's a very good program because they're currently giving you, once you fill it out, you can get a $10,000 advance. They're claiming that that $10,000 advance is forgiven. So that money is coming to you and it's already understood that you don't have to pay that back. So that's just an example. There's also another one that's a grant. You know, I won't get into all those because what everybody really wants to hear about is due to the administration's CARE Act that was passed last Friday, what is the greatest impact to us on that? The greatest impact to us on that is the Paycheck Protection Program. Now, the Paycheck Protection Program just recently got modified 7:30 last night. So I shot a whole video on it and I drew this all up on my whiteboard. So I'm going to ask you to go to that video and learn all about it. It's 20 minutes or less. One of the changes that happened that's not captured on that video is they made a decision to, when you submit for the loan, you're going to submit all of your payroll costs that were on a monthly average that can be verified by your 2019 tax return. So I was working with a client, their monthly average payroll cost was $145,000 a month. It was $145,000 a month for 2019. The PPP program is going to take that $145,000, they're going to multiply it by 2.5, and they're going to give you that for you to cover your employees for an 8-week period of time that begins at the loan origination date. You're going to get that for 8 weeks. That 2-month period of time, you're going to spend that money on covered costs, which are typically the payroll costs that they just talked about, which they use to fund the program with, to fund your check with, right? If you spend the money on those things, it's forgiven. If you spend the money on non-covered things, it turns into a loan. But here's what they changed. Instead of it being a 4% loan with a 10-year amortization, a 10-year term, it's now going to be a 0.5%, a 0.5% loan over a 2-year amortization. So many people are looking at this like, well, that's such cheap money. Whether it's let's say 2/3 of my expenditure is forgiven, and let's say the 1/3 isn't forgiven, who really cares? It's a 0.5%. Look, if you have a line of credit right now, chances are if you have money drawn on a line of credit, let's say you got $100,000 taken out on your line of credit and you're making monthly payments on, I almost guarantee you're paying about 4.25% on that right now. You get this loan, it's at a 0.5%. You know, there may be an opportunity for you to actually cover your people, get them all fully employed, get through this crisis, have a bucket of money left over, plop that money down on your line of credit, pay that thing down or pay it off entirely, and pay the government back at a 0.5%, which those payments don't even start for 6 months. Those payments will not even start for 6 months. So this PPP program is fantastic. You're going to be able to open up the application process hopefully tomorrow. I highly recommend you go to your business banker first, but you can go to any FDIC insured bank, credit union and start that application process. You should be gathering all of your information and creating a spreadsheet of what's required, because there are sample applications. It's a 4-page document. There's sample applications on our website. If Matthew could just confirm that for me, for you to go and already look at what's going to be required, and you should be getting ready for that. So are there any specific questions, Nicole, for this?
Yeah, so just, and Dan wrote in and asked, he just checked with his accountant who said LLC owners who take a draw or guaranteed payments are not included in the program calculations. Does this sound right? It would exclude an owner from any relief.
No, that doesn't sound right to me at all. It says clearly, and again, I'm not an accountant, and your accountant isn't the federal government. I'm not the federal government. So it's up to interpretation. I called my SBA branch. I also called my bank, because the bank is being informed by the government of what is covered and what isn't covered. So if I was you, I would start by calling your SBA local branch, and I would also call your bank. I would call both. Okay. I called the bank and I said, hey, is workers' compensation insurance covered in the equation for cost? And they said yes. They were told that workers' compensation is a covered cost in the payroll. Now you're asking if an owner takes a salary. Let's say you take a salary for $60,000, and then you take distributions of $100,000. Well, you're allowed to be compensated up to a total of $100,000 per employer and employee. That is for sure. Now, the question here is, will they consider my draw or distribution as compensation, just like they consider it a salary? Well, I'm just going to read to you exactly what they say, exactly what it says here. It's in this one right here. So now, again, I'm not a lawyer, I'm not a banker, I'm not an accountant, but I can read the verbatim quotes from the legislation. It's an 830-page document, and this is word for word what it does say. It says, payroll costs, there's 2 paragraphs for you to listen to here. The first one is this: payroll costs is defined very broadly and includes salary, which is, obviously a salaried person's every 2-week check, wages, which would be hourly pay, right? Commission, which could be considered bonuses, or similar compensation. So what do you think similar compensation means? If I'm getting paid a distribution or a draw, that's a similar compensation to my salary, or similar to commission or bonuses, right? But it goes on, it explains it even further. Even payments of cash tips or equivalent. Payments for vacation, parent, family, medical, sick leave, dismissal, separation, which could be severance pay, payments to group health insurance benefits, including insurance premiums, retirement benefits, state and local taxes. Then it goes on to say, in quotes, the sum of payments of any compensation to or income of a sole proprietor or independent contractor. Now, sole proprietor or independent contractor, look, a 1099 independent contractor does not pay taxes. They're not getting a salary. They're not a W-4 employee. They're an independent contractor. So they're saying the sum of payments of any compensation to or the income of a sole proprietor or independent contractor that is a wage, commission, income, net earnings from self-employment, or similar compensation, and that is in the amount that is not more than $100,000 per year. So to me, that second paragraph says it all. I don't know. I mean, I'm just interpreting what I read word for word. Maybe your accountant's interpreting it a little differently. I think you should go to your bank, and I think you should go to your SBA branch and really find that out. As far as I'm concerned, I'm pretty comfortable with my interpretation that distributions and draws should fall into it, but I could be totally wrong. I mean, they've been changing these definitions. And look, they did say you could write off the interest on debt. That was as of yesterday, and now they took that out of the legislation, and they said the only interest you can write off is on mortgages. So I can't be held accountable to this kind of advice because it's changing every single day. But that's what I know right now.
Okay. We have a question from Mindy. Does the $10,000 from the EIDL loan need to be part of a larger EIDL loan?
You have to file the EIDL application, which is a larger package. I believe it's a 7-page application. Once you get that in, then you can go back and submit I think it's a 2 or 3-page application, and it's called the EIDL Advance, and that's where you can capture that $10,000. They're saying upon receiving your application online, it's a 72-hour process, and you'll get a check direct deposited into your account.
Okay. Do you know what a approximate turnaround time, and I don't know if anyone's going to know this answer, from loan application to loan origination for the PPP?
The government has said publicly on TV and in the news that they want that turnaround time to be within 2 weeks. So most all of us are going to literally flood the portals tomorrow and submit our application. Although that's not always true. I called Wells Fargo and they said, hey, we're not going to be ready till Monday, Tuesday of next week. I called Fifth Third Bank. They're like, our portal's up and ready. As soon as they give us the go ahead, you can jump on the website and submit tomorrow. So it just goes to show you everybody's at a different point in their they're being prepared. Their preparation.
Do you know if you can apply for it tomorrow when it's the application start and defer your loan origination date?
No, originally it said you could submit and then you could select your 8-week window of time that you want covered between, I think it was February 29th or March 1st to June 30th. Now they're saying it goes on your origination date. So my way of understanding that or thinking with that is you got 30 million small business owners in this country, right? If everyone's going to jump on this in the next 5 days, starting tomorrow, well, the government's going to have to somehow stagger these loan origination dates, right? It's probably going to be a first come, first serve. So it's going to be covering you April through May, April through June. I mean, it's really, there's nobody knows. Nobody really knows. But my advice is get in early, get in soon, and hope for the best. Hope they follow through on the 2-week turnaround.
So the question is, that's next is anyone have a feeling of in the banking community of the likelihood of that $349 billion set aside of the PPP running out?
Yes. Unfortunately, I called my banker. You're not going to believe this. My banker and I were on the phone at 8:30 last night. We spoke for about 45 minutes, and he was giving me like minute-to-minute updates, which he had just gotten off the phone with their bank's accounting department. So, and we talked about this compensation, and their understanding was distributions, draws, salaries, hourly compensation. I mean, their communication to me was, as far as we're understanding reading legislation, that's sole proprietor compensation, right? So again, it kind of reinforced my interpretation, but again, we could all be wrong. So I always have to preface that. They did say that, I lost my train of thought. What was the question on that?
That's all right. I have actually another question.
What was
you're
that?
applying,
I knew the answer to that.
Oh, shoot, I don't know. I can't be in your brain.
Come
That would
on, what
make
was
me
that
crazy.
one? Something about the, will it run out? Yes, they said Steve Mnuchin was on TV and he said it's 349 billion, whatever, and it very well could run out. It very well could run out.
Okay. So the question that we have next is, if you file for PPP, can you do both the EIDL and the PPP, or is there a sequence if you can do them both, like one versus the other?
You can do both. You can't do a second PPP, but you can definitely have the EIDL, and you definitely can have a PPP. But do not spend, oh, my camera's going out of focus here. Do not spend money on your EIDL on covered compensation costs, payroll costs that you're going to pay through your PPP. So my little accountant advised us, when you take your PPP money, we did this already this week, open up a second business checking account. Let the PPP money go right into that second business checking account. Pay from that second business checking account only the covered expenses that you want forgiven that fall under that program. So you can audit that account's records of money in, money out. Don't let the PPP money commingle in your primary checking. Put the EIDL money in your primary checking, because you can spend that money on anything. You can spend that money on any business expense you wish. It's a loan. There is no question. That is a loan. I personally am going to put the EIDL money into a reserve account and just sit on it to make sure that the company gets through to the other side. Eat up your PPP money first on the covered expenses, and then use your EIDL money if need be. If I don't need it, I'm going to give it all back to the government. And guess what? You've got 6 months to decide on that, because for the first 6 months, you're not making any payments on the EIDL money.
So if you had to go order-wise, you would go PPP first, then EIDL.
I would definitely go PPP first, because there's a good chance that as long as you spend more than 75% of the funds on payroll costs and you have the same headcount or greater, it's forgiven. I mean, that's free money for sure. Do that.
This kind of question I think goes along with this. Maybe you've already answered this, but I'm just going to read it. So the strategy of taking PPP in full, in addition to as much as you can qualify for from the EIDL, would be smart to have cash on hand, even in the form of loan, to supplement cash flow beyond the PPP period, realizing the uncertainty beyond the 8-week time frame.
That's correct.
Would you
That's
agree?
correct. That's correct. Because I'm an eternal optimist. I think it's going to go and it's going to turn around. But let's say things don't turn around. It's good for you to have that money sitting in reserves. And remember, the EIDL money is literally at 3.75%. And if I'm not mistaken, I have to look that up. I think that goes into a 30-year term, not a 10-year term like the PPP was, although the PPP is not a 10-year term anymore because they changed that.
Yeah.
I'm going to look that up really quick. But that's a good deal.
Okay, while you're looking that up, the second part to that question would be, so would it make sense to retain full-time equivalent employees that choose to stay and fund them with the PPP even without income due to minimal patient flow?
Oh my gosh, that is a fabulous question. And literally, Nicole, you can chime in here too. We are booming here at Meg Academy. We are crushing our numbers in terms of helping people, because so many business owners are looking at this like, okay, so if the government's going to pay me to bring all these people back, but yet I don't have the patients for them to see or the primary production work for them to do, where should I spend? How should they spend their time? What they're doing is they're purchasing Meg Academy, which is a 24/7 virtual training, career development training program. And they're saying, well, I'm going to invest in my staff, which is the greatest asset of my business. And we're going to come out of this 8 weeks later with the highest trained, highest skilled, greatest, most educated people, so that all of our policies and procedures are up to date. All of our compliance issues are now in place. All of the way in which our workflow works is consistent with what I've always wanted for my practice. When I was talking to my banker and he was getting re-familiarized with everything I do, he's like, do you know, this reminds me of the financial crash of 2008. And I said, how so? He goes, I had these two guys that had this staffing company and they had this training staffing company. They kept all their employees through the crisis of 2008, nearly bled them dry of every nickel they had in savings. And all they did is pump the training into their staff. And when the financial crisis ended, they jumped way out in front of everybody else because their staff was so much better trained and so much better prepared. He says they literally grew from a $30 million company to a $986 million company and then sold it in 4 years after the financial crisis. And I was just like blown away because I'm like, that's just our wheelhouse. That is what we do, is enhance staff. So whether you use us, whether you contact us or not, the main thrust here is invest the time and resources into your staff at this window because you don't have anything else for them to do. Make them the best that you can make them.
Excellent. Which, by the way, on that note, we are actually extending our discount. I just want to give everyone a heads up. You'll get the official email tomorrow, but we've had such a good response to people taking full advantage of that. So our Meg Academy clients that are getting the user packages at half off. So, we want to extend that since the stay-at-home order has been extended. We want to kind of mirror that and extend it for another week. So you will be getting that email tomorrow.
That's a great idea. I didn't even know you were doing that.
Yeah.
That's great.
I'll let
That's
you
a
in on it.
fantastic idea. Well, that's going to help a lot of people because they get to get
Yeah.
a 50% discount, and this is the time to do it. So
Yes, exactly. So just a couple more questions on PPP. When filling out the PPP application, are you able to add in an outside billing company into your payroll costs up to the 100,000 cap? That's a great question.
That's a great question. Outside billing company, no. I can't envision how that would fly. That's a contract service, and you're contracting with a company, not an individual. If you had a 1099 biller, Yes. If you have a 1099 bookkeeper, yes. But another company, I'm not able to see that. Again, I don't have a crystal ball on it, but I've not read anything. I mean, honestly, if I knew that, I would have told all of our hundreds of billing clients, like, hey, use us to, get a greater, increased check, for you to live on. But I don't know. I can't see how that would be okay. We're not a 1099 contractor.
Yes. Okay. And do you know, did you mention, I think you mentioned this, do you know the interest rate on the EIDL? Did you answer that?
Yeah, it's 3.75.
Okay, great.
Oh, I
And
was looking up the term. I was looking up the term.
yes, is there any other loans available?
Yeah, there's multiple loans. Like in the state of Florida, there's actually for the Family First Corona response,
Coronavirus Response Act.
there is a tax credit package there. So I have this on my list to look into. In the state of Florida, there's an SBDC, Small Business Development Center loan, which is a bridge loan, which could be 50,000 up to 100,000. Every single state, contact your state SBA, find out if they are offering state loans as well. There's another one that's like the EIDL. It's called the EEIC, I believe it is. It's a grant, or EEIG. So there's another one that's a grant. I would look into that. So yes, there are other loan packages,
Options.
but go through your SBA, because the government is trying to do them in such a manner that they will be forgiven.
Okay, so we have a question from Gail. If I have part-time employees, how does that factor into FTE? Is PPP only for full-time equivalents, or 2 part-time employees that add up to 1 full-time equivalent?
Well, you just said the same thing twice. FTEs are full-time equivalents. Gosh, what's wrong with my camera all of a sudden? What's going on? Yeah, FTEs are full-time equivalents. So if you have 20 people working 40 hours a week, or 40 people working 20 hours a week, that is the same thing. Those are full-time equivalents. So that is actually the same thing. It is only on full-time equivalents. It's not on specific bodies. It's on full-time equivalents.
Okay,
So
good.
that's how they're going to run the calculation, and that's how you're going to qualify when you're distributing.
Okay, so coming off of, the financial assistance from people that are already existing businesses, I want to jump over and hit, because this question came last time too, and we didn't quite get to it. But can you address the eligibility options of those that are in the startup stages, who haven't had expenses and haven't started seeing patients yet?
Okay. Small business debt relief program. Oh, that's not going to be necessarily what you're asking. So there's a small business debt relief program, and those are
you
the
also mentioned the traditional 7A loan program.
7A loan, the 504 loan, the micro loans. Okay. These loans can be available for borrowers. Take out loans within 6 months of the present time. Okay. So don't worry about that. Oh, this was the other one that I was saying that you should look into, everybody. It's called the Emergency Economic Injury Grant. Now, those are grants. These grants provide emergency advances up to $10,000 for small businesses and private nonprofits that are harmed by the COVID-19 and are paid within 3 days. I believe that is referring to the EIDL advance. So I think those are the same thing. So it does say, the advance does not need to be repaid under any circumstances. It may be used to keep employees on payroll, pay other debts, other business obligations. So those two are, from my interpretation, the exact same thing, the Emergency Economic Injury Grant. So take a look at that. Again, go through your SBA. There is, I was reading, those are small business tax provisions.
You had mentioned, I know to me, that there are state versions of the program for
Yes.
the traditional 7A loan program.
Yes, there are state versions of the
For
program.
like underserved areas, women owners,
Yes.
veterans.
Yes, that's why you want to go to your local SBA, and there's different kinds of SBA packages that have nothing to do with disaster or crisis or anything, that can simply fund your startups. And they'll list them there and tell you exactly which ones you want to go for. If you're in a rural, underserved area, if you're a veteran, if you're a female entrepreneur, go pursue those, especially if you're a startup. This is the best time to start up your clinic. You're going to get good financing. You're going to get good space. You have plenty of time to get trained and get your hat on your head on how to be a good CEO, how to be a good practice owner. And then if your doors open in 4 to 6 months, that's the sweet spot from what I can tell.
And just real briefly, I just want to touch on, we had the question last week and we didn't know the answer to it, but can you address the eligibility and options for those that have over 500 employees?
Yeah, there is a document that I have, and I had it up on my computer right here. I had it in my hand too. And it says, if you are over 500 employees, click here to go to the link and look for the specific exceptions to get coverage for over 500 employees. I didn't click on it and go there because I was like, well, that's not the majority of who I'm working with or what I'm doing, but it's in there, and it's probably right here in my care, well, not that one, my care package. Where did I put that? It might be in the PPA. I've got so many folders and all these things, but yes, it does say there is, oh, this is what it is. It's here. It's called the Paycheck Protection Program Information Sheet for borrowers. I'm going to show you here, there. Matthew should have this one. I got this one from my banker, I believe. And I don't know if we put that up on our resource page or not, but if you go down here to the bottom where you see those blue where it says here, here, and here, it does say, okay, businesses in certain industries can have more than 500 employees if they meet applicable SBA employee-based size standards for those industries. Click here for the additional details. That's the only reference I've ever seen that you can learn more about how to see what is covered, what isn't covered if you're over 500. So find that document. I'll make sure that we have it on our site, or maybe just email us.
Should be on the chat right now. Yep.
Yeah.
What, Matt?
Yeah.
It's on the chat right now if anybody wants to click on it.
There you go. Everybody has to have a Matthew.
We have a question about when the calculation for the FTE starts. They just recently let go of 2 part-time employees 2 weeks ago.
Okay, so this is interesting. This recently changed as well. So you're going to have to establish a baseline of FTEs. You're going to look at your payrolls between January 1 of 2020 and February 29th of 2020. I believe there's 5 payrolls. You're going to run the calculation on what your average FTE was between those 5 payrolls in that window of time. And I think there's 5 payrolls. I don't know if Matt can look it up, or maybe Nicole while I'm talking. I think there's 5 payrolls from January 1, 2020 to February 29, 2020. Let's say your average FTE is 30 for that. When you get your loan origination date and you go through the program, you have to have your FTE up to that amount by June 30th, by the end of the program, by the end of your 8-week period of time. If I look at that, I think it says, it may even say it has to become an average of that. What I do know is your payroll cost, your payroll cut, like if you reduce, let's say you have as many people, but you reduce their pay, cannot be greater than a 25% cut. You cannot reduce your employees' pay by greater than 20%.
So would it be wise to bring
25%, 25%, I'm sorry. Say that again, Nicole.
Would it be wise to bring them back?
Yes, it would be wise to bring them back. Now, again, let's not get crazy here. Let's say you have greater than a 25% cut. Let's say you don't bring all the people back. Whatever's not eligible for forgiveness becomes a loan at 0.5%. So don't, I had somebody call me earlier today from California, and he said, look, I had 29 employees. I'm down to 14 or whatever I have now. The rest are on unemployment. They're furloughed. They're being fully covered. They're fully happy. They've got this handled. They're waiting to come back as soon as I have the work. Does it pay for me to bring all those people back just to get this forgiven for my, and I said, no. I said, do the math. I really don't see how that's going to pay unless you have the work for them, unless you have because what's in the best interest for the employee in some regards, like who have kids who are home, they're homeschooled, they're going to be dealing with the dynamics of that. They're getting paid their full pay plus an extra $600 that the government's giving in unemployment, right? Let's say that's happening. You're going to bring them back and they're actually going to get paid less and they're going to do less. And now they got childcare issues, and you know, you're going to have to really think this through as to what you want to do with your staff. I'm all encouraging of you bringing everybody back and getting them busy and let's get back on the stick. But if we're still at the stay-at-home order and you don't have the caseload even close, you're going to have to weigh, is it better for me to leave some people on unemployment who are really getting paid in full and taking care of their kids, or it's in their best interest to do so, and keep my other core people busy here at work until we ramp up through this period of time? You're really going to have to weigh that.
We had a question in regards to that unemployment benefit. So in regards to that unemployment benefit that provides an additional $600 per week while the employee is furloughed, how does that employee apply for that or obtain that? Is it automatic?
If they're furloughed, that means they're temporarily laid off. That's a temporary layoff. While they're on their temporary layoff, you, the employer, must pay all of their health insurance and everything that goes along with that, benefits, so that they don't get reduced. They must allow for 40 hours of openings to come back to work at your phone call. But they need to apply for unemployment. They need to apply for unemployment so that they can get the unemployment coverage that's due them for being let go due to the COVID-19 situation.
Yeah, we're getting some feedback that is it Leon, in his state, unemployment is only 60% of salary. Is it state to state specific, or is there?
That is not true. That is not true at this very moment. As far as I know, the federal government has superseded those original standards. Most states were at 70%, maybe Leon's state was 60%. I could understand that. But according to this CARES Act and according to the federal government stimulus package that was passed, the federal government is assuring that people will be paid at 100% of their wages plus $600. So just go back and look at the stimulus package, watch the news, check that out. I think you'll see that is actually what the unemployment is. And you can Google it as well. Again, I'm not an accountant, I'm not a lawyer. My understanding is the states can't dictate that. The federal government's paying the unemployment. They're shoring that up. They're the ones driving that.
And just to revisit, Brian, the startups, because I want to address Tommy's question here. He, was set to open April 1st. Obviously, things have been postponed. They don't have any SBA loans yet. What would be the best strategy for him moving forward?
Okay, so let me answer that, but let me give you, I looked up the answer to the question just a minute ago. Rehiring. You have until June 30th of 2020 to restore your full-time employment, FTEs, and salary levels that you made changes on between February 2020 and February 15, 2020 to April 26, 2020. So any changes in staff that you made in reducing pay or reducing headcount between February 15th and April 26th of 2020, you have until June 30th to restore it. If you restore it, then you qualify for the forgiveness. So I just wanted to make that clear, right? Perfect. I want to point that out.
Okay.
If you're a startup and you're looking to start up your business, look, you've been disadvantaged because of this. Contact your local SBA district office. Explain to them that you are ready to open your doors. Which loan program best suited for me? These loan programs are both federal and state. So that's why I want you to contact your local SBA district office. And you can find that online. It's very easy to click on your local district office. I did it 3 times today alone.
Perfect. All right.
Yeah, I called them.
Perfect. Okay, so I think that pretty much wraps up all of our questions. Again, guys, you make this worthwhile for everybody when you're asking your questions. So I really appreciate all of the participation and all of the outflowing of questions. So keep them coming. We'll be answering more next week on Tuesday and Thursday. We're planning to continue at twice a week, especially during this time when things are changing so rapidly. Next week, we do want to have a theme of covering this idea of compliance. A lot of people, are flowing a lot more data out, via email, and there can be room for errors with compliance. So we do want to hit on making sure your bases are covered with that. And we're going to bring in a specialist on compliance for that talk on Tuesday. So we really hope you join us again on Tuesday. And again, we'll continue this ongoing conversation as things evolve and change with telehealth, as well as the stimulus package and CARES package. Brian, anything else to add before we sign off here?
No, I just want to say, if I'm a little short, it's just lack of sleep, because I've been staying up till 1 o'clock in the morning going through this every day. So I really applaud you, Nicole. You're doing a great job broadcasting this and putting this whole team together. And Matthew, producing it and keeping every single reference I pull on, you get it up there for everybody. I just can't give you guys enough credit, to be honest with you. And for everybody listening and everybody chiming in your questions, I'm just so genuinely grateful for you guys asking the questions, because I know there's probably 10 other people wanting to know those answers as well. And it makes me dig deep to find the answers for you, which is why I brought all my materials with me. I'm going to end off by just saying, this is a forum where we're all here to help each other. I don't know all the answers. I'm trying to give you the best information I can. It's constantly changing, but I will give you this: www.sba.gov. Go to www.sba.gov. Click on your local district. Every single website that I have seen for these SBA has been updated pretty regularly. They're trying to get the information out as quick as possible. I think you can get a lot of your questions answered there, or go to megbusinessmanagement.com. Literally our website, our resource page has the most, current releases of all of this stuff. So thank you, Nicole. Thank you, everybody, for your questions. I think this is what helps all of us, is just helping each other.
And a special thank you to Bettina. Thank you for joining us today. You were amazingly helpful in terms of sharing what you're doing in your community. So keep up the good work.
Yeah.
Thanks, Nicole. Thanks, you guys. Be safe.
All right.
Thank you.
Well.
Thank you,
Bye,
everybody.
guys.
Oh, what's our